Okay, so now I'm going to demonstrate an abdominal examination. First of all, obviously, you'd introduce yourself to the patient. Hello, Mr. Jones, I'm Dr. Mullen. I'd like to do an examination of your tummy today and have a general look at you, if that's okay.
Okay.
Once you've done that, I would always start by having a look around the bed, first of all, just to make sure there's no clues there at all. Then obviously I'd like to take a look at the patient from the end of the bed. So I've asked you to just rest your hands down by your side, please. Just looking if there's anything obvious on general examination. I'd also like to ask the patient to take a deep breath in at this point and out. And I'd ask the patient to cough. Okay. Once I've done that, I'd move on to the hands. So I'd ask you to lift your hands up for me, sir. Looking in both hands, looking for any signs that might indicate chronic liver disease or clubbing. So we're looking for pulmonary erythema, looking for any evidence of Dupuytren's contractures. You may want to just push your hands across the palms there. You may also note any other nail changes such as koilonychia or leukonychia if present. Then what I'd like to do is check for a metabolic flap. So if I ask the patient to put his hands out like that and cock your wrists back. Just seeing if there's any evidence there. Just for a few seconds. That's fine. Rest your hands down. And what I'd always do now is just check the rest of the arms, just making sure I'm not missing any scars or fistulas in renal cases. Just make sure I'm missing anything in the arms here. Okay. Once I've done that, I'll move on to the patient's face. So I'd ask the patient if I could just pop his glasses off and check in. You use one eye, but check the conjunctiva for any pallor. Okay. Have a general look in the face and then ask the patient to open his mouth. Obviously you're looking at things like dentition, and ask them to put his tongue up to the air, please. Okay, that's fine. Then I'll move further down, having a look around, first of all in the neck, looking for any scars, looking on the chest for any spider nevi or anything else along those lines, and then move down to a closer examination of the abdomen, just see first and foremost whether there's any scars or any obvious deformity that I can see. If I was happy at this point, I'd move on to palpation. So get down to the patient level. Just check with the patient you've got no discomfort anywhere, and just make sure you're not going to hurt him if you do palpate. So first of all, I'm just going to do light palpation. Just in the 9 common areas. Watching the patient's face just to make sure you're not causing him any discomfort. Okay, just going to press a little bit deeper now, just to make sure that there's no masses or anything that you can feel. Okay, now I'm going to move on to assess for hepatomegaly. So ask the patient to take some deep breaths in and out, please. Start in the left iliac fossa. Work your way up. Try to feel for any liver edge coming down underneath your fingers on inspiration. Okay. And also percuss down from the chest wall. This will allow you to make any estimate on the size of the liver or hepatomegaly. We'll do exactly the same thing for the spleen. Just take some deep breaths in and out again for me. Okay, ask the patient to roll towards me. That's okay. Again, just feeling for the spleen underneath the rib margin. Deep breath in out for me. Okay, you can turn back on your back again. Again, I'm just going to percuss across for the spleen. Okay, move on to palpate for the kidneys. So place one hand underneath. See if I can blot any masses between my two hands. Okay. Once I've done that, I go on to assess for shifting dullness. So if it goes dull at all in the flanks, I'll ask the patient to turn towards me. Ideally, you'd like to wait for 30 seconds, so you may be like to take this opportunity to look at the patient's back, see if you can appreciate any scars or anything like that. And then you're going to percuss in the same spot. There's no shifting dullness, so I'd ask the patient to go back again. I'm just going to move on to auscultation. Firstly for bowel sounds. And then for any abdominal or renal artery bruits. Okay. Once that's done, I'll complete my examination by having a look at the patient's ankles. Just ask him to roll the legs up there, just to see if there's any edema. Roll his socks down there. Again, ask him if it's okay if you can press on his legs. Just press down for about 5 seconds on the bony prominence. Make sure there's no edema. In this situation, I'd also like the patient to sit up for me, if that's okay. Take another close look on the back, see if you can see any scars. And then I'll just check primarily in the supraclavicular fossa for any lymphadenopathy. You may also like to check cervically as well. That's great. That's fine. Thank you very much.
Thanks.
And I would say that to complete my examination, I would like to perform a digital rectal examination, examine the hernial orifices and for any inguinal lymphadenopathy or herniae, and also like to perform a dipstick of the patient's urine.